Hello, and welcome to the W.A.I.T channel. What Am I Thinking? A podcast where two sisters share uplifting conversations on fun and sometimes serious topics.
Join us each week by clicking the notification bell and subscribing to our channel. If you enjoy the show, use the share link. It's one of the best ways to expand the conversation.
Welcome back to the W.A.I.T channel. What am I thinking? Today we're thinking about mental health. Recently, we all learned about NAMI Judd. A day before she was actually supposed to receive an award, we learned about her depression and how she was unable to hold on, and she decided that she wanted to take her own life. So the coroner basically did affirm that it was a suicide. So sad, but it also should bring attention to certain mental health disorders that are minimized, or that people often say, lift up your chin, it'll be okay. Depression is a real thing. And whereas some people do have mild forms and they are able to move beyond it and past it, not everyone, their journey is not the same. For some people, it is a combination of things, whether it's medication, counseling, support system, in-house treatment. They need help because they are having a real physical problem. What are your thoughts on this, Tracy? This is definitely your wheelhouse.
So, one of the things that makes mental health issues so challenging are the societal stigmas that are attached to it. You have people saying things like, oh, go take your crazy pills. The idea that people have now wanted to say that, everybody is bipolar. None of those things are funny. None of those things should be joked about. Do we joke about people having heart attacks or diabetes? I don't think since Fred Sanford I've heard anybody joking about having a heart attack. Mm-hmm. So we don't joke about physical health issues. So why do we get to characterize mental health issues in any form of negative light? We should not.
And it's as you were talking, it wasn't until you brought up the Fred Sanford that I kind of reflected back on how they would, women in the 50s and 60s, she's having a little nervous break, mm-hmm. and women literally would be admitted to the hospital mm-hmm. for a week or two. Mm-hmm. What they were giving them, I don't know. Mm-hmm. But it was socially acceptable. It was not something that was positive to say that you had a nervous breakdown. Right. And I can't tell you how many family members I had to re-educate. There is no such thing as a nerve pill. Yes, absolutely.
We're the same family, so yeah.
Right, right. But these are the terms that we attach to real emotional, mm-hmm. physical, mental things that mm-hmm. people were struggling with.
Yeah. And it is, even people of faith are guilty of it, because your faith is not strong enough for you to just pray it away. And these are real chemical imbalances. These are things that, when somebody has a bad experience with a medication, then they want to say, I don't want to take it anymore. Well, once again, with physical health, they may not get the medication right. They may not get the dose right. It may take you a minute to find the right high blood pressure medicine. It may take a minute to find the right level of insulin or whatever. You don't throw in the towel for that treatment. So don't do it for your mental health. And another thing that we get wrong a lot of times when it comes to mental health is that we want our primary care doctors to fix everything. So, no slight to the primary care doctor, but when they send you to a cardiologist, an oncologist, a urologist, whomever you go, don't let them make you feel that their specialty is also psychiatry. Just because they can prescribe doesn't mean they should be your main prescriber for your mental health medications. It's fine to go to a psychiatrist, get your assessment, let them say, yes, you need medicine, no, you don't, get you on a dose that works. And then for your refills, if you want to go to your primary care, that's fine. But at least you and your psychiatrist need to have a check-in, whether they say every 6 months, once a quarter, once a year, whatever they deem is necessary for you. That's what you need to do, the same way you do with most other specialists. Your primary care doctor is fine to check in between, but they should not be the only person that you're seeing when it comes to your mental health medication. So don't be dismissive of it and feel like when you see what they get as far as learning in medical school when it comes to the psychiatry side of things, you would not want them prescribing if you knew how much of a focus it gets. It's a specialty for a reason. Okay? So take that part of it seriously. And to any primary care doctors that are listening, if you're still choosing to prescribe the medication, you are remiss to prescribe the medication without telling them they also need to probably see a talk therapist for an assessment. Because most times the best results come with a combination of things. It's typically not going to be just one thing that's going to help you be better. So be open to a regimen. Be open to having a team the same way you would for any other chronic illness.
I think it's also important to understand, and specifically with depression, that it's not exclusive to men, women, or any particular race or any particular age, or social status, fame.
Right.
It doesn't matter.
It doesn't.
It can affect anybody.
Right.
And I like that you spoke about how we would treat our bodies if we had hypertension or if we had diabetes. We would take the medication, and when the pharmacist said, okay, I can't feel it anymore, you got to go back and see that doctor, we would go in there and we would see that doctor. But when it comes to mental health, and I'm not even sure around the world how other countries view it. I know Eastern medicine, they are a little more holistic when it comes to it, but I do also know that Asians can be very dismissive, and it could be something that's taboo. It's a sign of weakness. So I know that as a species, we have a lot of growing to do. And the funny thing about that is, while we are still mapping the brain, there is more. It's kind of like the ocean. We live on a planet that mainly is water, but we haven't even explored. Like, it's a very small percentage of how much we've actually explored. That's the way the brain is. So I'm glad that we at least have stopped saying, oh, she's crazy.
Have we?
I'll say those of us in the medical profession. It has gotten better because I can remember hearing doctors say that, nurses say that, and just throw that word around because it was a science I felt wasn't really respected because we felt it. You can snap out of it if you wanted to snap out of it. I feel we've come a long way, and we now know no.
Right.
They can't just snap out of it.
Right. It's not okay to say somebody's crazy. It's not okay to say somebody's schizo. It's not okay to say somebody's bipolar. It's not okay to say somebody's retarded. It's not okay.
Mm-hmm.
People are no longer mentally retarded. They are intellectually disabled. And people are more than their diagnosis. They're people first. People who happen to be diagnosed with something. And like I said, we don't do that to people when it comes to their physical health. We don't make their diabetes be the first thing that we note about them. So don't do it with their mental health. And another thing when it comes to depression specifically, it's not just about being a little sad. I do this thing with clients to try to see on where the intervention needs to happen. And we've gotten a lot better with the levels of care that we can provide. It doesn't have to always be inpatient treatment. They have intensive outpatient treatment. They have partial hospitalization, and you have outpatient therapy. And we can do so much virtually now. One of the good things that came out of the pandemic, people who would have never thought about getting treatment, counseling, or anything can be within the confines of their own home and get help. So one of the things I would tell the person, say you're sitting at the bottom of a hole and I drop down a rope. Are you able to stand up and pull yourself out? You say no. Am I able to drop down a ladder? Can you climb out on that ladder? If you still tell me no, that even with that you can't climb out, then that's a great assessment for me. If I can drop the rope down and you say, yeah, I think I can climb out if you drop down a rope, then that's typically somebody that probably just needs talk therapy. If I am unable, if you say no, even when you drop the rope, I can't, then I'm going to drop down a ladder. If I drop that ladder down, can you climb out? And they say, yeah, I think I probably could. Then that's a person that may need talk therapy and some medication. We probably need some medication management. If you say I dropped the ladder down and you still can't do anything but sit there, you need a higher level of care. You may need intensive outpatient, or if you say I can start up it, but I don't think I can get all the way out, or if you say you can't start, then I'm going to say you need to be assessed for inpatient care. And literally, that is how it can be for some individuals. They cannot function. They can't get out of the bed, or they can get out of the bed and do what they need to do to go to work because that rope memory is there and they can do those things. But as soon as it's over, they can't do anything else. They can't fix a meal for themselves. It is real. It's not about what they have. It's just about their inability to get out of the fog.
And this even, it goes to the point of it being something that is physically going on in the body. Mm-hmm. When I would teach about postpartum depression, mm-hmm. I wouldn't let the mom go home without going over it and going over the symptoms and letting her know that there's a 75% chance that she mm-hmm. will experience some degree of it. Mm-hmm. But I wouldn't just teach the mom. I always wanted someone else there to hear it too. So if you are around someone, it is important for you to recognize those signs. it's important to recognize that when you ask, are you okay? Just hearing, yeah, I'm fine.
Mm-hmm.
Some people, they feel a sense of relief because then they don't have to do anything. But if you're seeing abnormal behavior, or a person is not interested in things that they once were interested in, that they are disengaging, if these are just little subtle or even overt things, it is incumbent upon you to act.
That's exactly right.
Yeah.
That's exactly right. And we do the same thing when it comes to other types of trauma.
Mm-hmm.
You know, and in the world we live in today, unfortunately, there's so many types and ways in which people can become traumatized, and that trauma, dealing with that, a lot of times it ends up being starting with anxiety. But we now know that anxiety and depression can feed off of each other. Mm-hmm. You can deal with just anxiety, and if it goes untreated with no meaningful intervention, you can end up with depression. You can have depression. If it goes untreated with no meaningful intervention, then you can also end up becoming anxious and dealing with anxiety. The two of them together, you don't want. You don't want. So at the earliest sign that something is not right, at a minimum, connect and talk to somebody and let them see and hear what's going on, and then let them recommend what else you may need. Sometimes talk therapy is all it requires. Sometimes you need a little bit more. And here's the last thing I'll say about it. When you get on medication and you start to feel better, once you start to feel better, it's not the sign that you should stop taking the medication. Don't ever take yourself off of your psychotropic medications. Work with a doctor and let them decide what's best. Once again, you wouldn't just stop taking your heart medicine. So don't feel that the medication is an enemy. It is part of the cure.
So we're going to end on that note. So just remember, not only look out for your own mental health, but look out for those that are around you, your loved ones, people that you work with. It does take a village, and it's always better to be overly cautious and say something than to not say anything at all. So thank you for listening, and we look forward to talking to you again on What Am I Thinking? Bye-bye.